Which of the following is not a typical symptom of Meniere's disease? Options are vertigo, hearing loss, tinnitus, fever. Answer of this question is fever. Meniere's disease typically present with vertigo, hearing loss, tinnitus. Fever is not a associated symptom with Meniere's disease. What is the most common cause of vertigo and Meniere's disease? Labyrinthitis, vestibular neuronitis, endolymphatic hydrops, BPPV. Answer of this question is endolymphatic hydrops. The hallmark of Meniere's disease is the endolymphatic hydrops, which refer to the abnormal accumulation of endolymphatic fluids within the inner ear. Which test is often used to confirm the diagnosis of Meniere's disease? MRI, pure tone audiometry, CT scan, electrocochleography. Answer of this question is pure tone audiometry. In audiometry, typically unilateral SN loss with clinical symptomatology is the diagnostic of Meniere's disease. MRI and CT are less commonly used. Which hearing frequency is commonly affected in Meniere's disease? Options are high frequency, low frequency, middle frequency, and all frequency equally affected. Answer of this question is low frequency are commonly affected. Meniere's disease typically present with low frequency sensory hearing loss. What type of hearing loss is characteristic of Meniere's disease? Conductive, sensory, mixed, central. Answer of this question is sensory hearing loss is the common in Meniere's disease. Meniere's disease primary causes sensory hearing loss because of damage of the inner ear structures. These symptoms is usually the first to appear in the Meniere's disease: vertigo, hearing loss, tinnitus, oral fullness. Answer of this question is oral fullness is first to appear. Oral fullness or sensation of pressure in the ear is often the earliest symptom of Meniere's disease. How long do vertigo attacks typically last in Meniere's disease? Seconds, minutes, hours, days. Answer of this question is hours. Vertigo attacks in Meniere's disease typically last from 20 minutes to several hours. Which of the following is a recommended lifestyle modification for patients with Meniere's disease? High salt diet, high caffeine intake, low sodium diet, smoking. Answer of this question is low sodium diet. Low sodium diet is recommended to help reduce fluid retention in the inner ear, which manage symptom of Meniere's disease. Which of these medications is commonly used to manage vertigo in Meniere's disease? Antihistaminics, antibiotics, beta blocker, or insulin? Answer of this is the antihistaminics. Antihistamines such as meclizine are commonly used to manage vertigo in Meniere's disease. Which surgical procedure is used to alleviate vertigo in refractory disease? Cochlear implant, labyrinthectomy, stapedectomy, tympanoplasty. Answer of this question is labyrinthectomy. Labyrinthectomy is surgical procedure that remove the balance organ of the inner ear and used in refractory cases of vertigo. What is the pathological hallmark of Meniere's disease? Endolymphatic hydrops, perilymphatic fistula, vestibular schwannoma, autosclerosis. Answer of this question is endolymphatic hydrops. Endolymphatic hydrops, the accumulation of fluid in the endolymphatic sac and duct, is the pathological hallmark of Meniere's disease. Which of the following is not a typical treatment option for Meniere's disease? Diuretics, intratympanic steroids, beta blockers, vestibular rehabilitation. So answer of this question is beta blockers. Beta blockers are not typically used to treat Meniere's disease. Management usually involve diuretics, steroids, and vestibular rehabilitation. Meniere's disease primarily affects which part of the ear? Outer ear, middle ear, inner ear, and ear canal. Answer of this question is inner ear. Meniere's disease affects the inner ear, especially the labyrinthine where the fluid imbalance is there. Which imaging modality is most useful to ruling out other causes of vertigo in suspected Meniere's disease? CT scan, MRI, X-ray, ultrasound. Answer of this question is MRI. MRI is used to rule out other causes of vertigo such as vestibular schwannoma, multiple sclerosis, or patients suspected with Meniere's disease. Which genetic component has been linked to increased risk of Meniere's disease? Autosomal recessive inheritance, familial clustering, X-linked inheritance, no genetic component. Answer of this question is familial clustering. There is evidence of familial clustering suggesting a genetic component in Meniere's disease, though it is not follow a simple Mendelian inheritance pattern. What is the typical course of Meniere's disease? Progressive worsening without remission, monophagic, fluctuating in episodic, and always resolve spontaneously. Answer of this question is fluctuating in episodic hearing loss. That is, Meniere's disease is characterized by episodic and fluctuating symptoms with vertigo, tinnitus, and hearing loss. Which of the following is a common trigger for Meniere's disease attacks? High fat diet, stress, excessive sleep, cold weather. Answer of this question is stress. Stress, fatigue, dietary factors such as high salt intake trigger the attacks of the Meniere's disease. In Meniere's disease, tinnitus is typically bilateral, unilateral, central, non-existent. Answer of this question is unilateral. Tinnitus in Meniere's disease is typically unilateral, affecting the same ear as the vertigo and hearing loss. Which of the following medications can be used as vestibular suppressants in Meniere's disease? Diazepam, paracetamol, metformin, atenolol. Out of this option is diazepam is correct. Diazepam is vestibular suppressant that can help reduce vertigo symptoms in Meniere's disease. What is the main goal of treatment in Meniere's disease? Options are cure the disease, control vertigo symptoms, improve hearing, and eliminate tinnitus. Answer of this question is control vertigo symptoms. The primary goal of treatment in Meniere's disease is to control vertigo symptoms to improve the patient's quality of life. Which of these is a long-term complication of Meniere's disease? Chronic vertigo, permanent hearing loss, cochlear implant necessity, all of the above. Answer of this question is all of the above. Meniere's disease can lead to chronic vertigo, permanent hearing loss, and severe cases cochlear implant may be necessary. Which surgical procedure for Meniere's disease aim to preserve hearing? Vestibular nerve section, labyrinthectomy, cochlear implant, and endolymphatic sac decompression. Out of this is best option is endolymphatic sac decompression. Endolymphatic sac decompression is a procedure that aim to reduce endolymphatic pressure and preserve hearing, unlike labyrinthectomy or vestibular nerve sectioning, which may result in hearing loss. What is the primary action of diuretics in managing Meniere's disease? Reduce vertigo, decrease fluid retention, improve hearing, eliminate tinnitus. Answer of this question is decrease fluid retention. Diuretics are used in Meniere's disease to decrease fluid retention and thereby reduce the pressure of endolymphatic fluid within the inner ear. What is a common side effect of long-term corticosteroid use in Meniere's disease? Hyperglycemia, hearing improvement, weight loss, improved vertigo. Answer is hyperglycemia. Long-term use of corticosteroids can lead to side effects such as hyperglycemia, osteoporosis, and increased risk of infections. Which dietary modifications is most commonly recommended for Meniere's disease? High protein diet, low carbohydrate diet, low sodium diet, high calcium diet. Answer is low sodium diet. Low sodium diet is commonly recommended to help reduce endolymphatic pressure and minimize the frequency of Meniere's disease attacks. Which is not a risk factor for developing Meniere's disease? Age over 50, family history, previous ear infection, and smoking. Answer is smoking. Smoking is not a well-established risk factor for Meniere's disease, where age, family history, and a history of ear infection are associated with increased risk. Which of the following tests measure vestibular function in Meniere's disease? Audiogram, electronystagmography, tympanometry, Rinne's test. Answer is electronystagmography. Electronystagmography measures vestibular function by evaluating eye movements in response to stimuli and is commonly used to assess balance disorder including Meniere's disease. Which of the following is an invasive treatment option for refractory Meniere's disease? Intratympanic gentamicin therapy, low salt diet, vestibular rehabilitation, stress management. Out of this, answer is intratympanic gentamicin injection. Intratympanic gentamicin inject are used to selectively ablate the vestibular function in cases of refractory Meniere's disease when other treatment have failed. Which of the following is the most feared complication of untreated Meniere's disease? Chronic sinusitis, permanent hearing loss, otitis media, ear canal stenosis. Answer is permanent hearing loss. Permanent hearing loss is a major complication of untreated Meniere's disease due to progressive damage to the inner ear structures. What type of vertigo is typically experienced in Meniere's disease? Positional, non-positional, continuous, central. Answer is non-positional. Vertigo in Meniere's disease is typically non-positional and spontaneous, occurring in discrete episodes. Which is the characteristic finding on audiometry in early Meniere's disease? Flat audiogram, low frequency SN loss, high frequency conductive hearing loss, and normal hearing threshold. Answer is low frequency hearing loss. Early Meniere's disease is characterized by low frequency sensory hearing loss, which is fluctuative and unilateral. Which maneuver can be used to assess vestibular function in Meniere's disease? Apley maneuver, disc Kolpike test, Romberg test, head impulse test. Answer is head impulse test. The head impulse test can be used to assess vestibular function and is useful in evaluating patients with Meniere's disease for vestibular deficits. Meniere's disease is primarily a disorder of which system? Cardiovascular, nervous, endocrine, vestibular. Answer is vestibular system. Meniere's disease primarily affects the vestibular system, which include inner ear structure responsible for balance. Which of the following audiometric pattern is most indicative of Meniere's disease? Rising configuration, sloping configuration, flat configuration, U-shaped configuration. Answer is rising configuration. Rising configuration means there is more hearing loss on the lower frequencies. Which is a first line pharmacological treatment for acute vertigo in Meniere's disease? Beta blockers, antihistamines, antibiotic, antidepressant. Answer is antihistamines. Antihistaminics like meclizine are commonly used to treat or manage acute vertigo in Meniere's disease. Which cranial nerve is primarily affected in Meniere's disease? Trigeminal, facial, vestibulocochlear, glossopharyngeal. Answer of this question is vestibulocochlear. The vestibulocochlear nerve is primarily affected in Meniere's disease as it transmits sensory information related to hearing and balance from the inner ear to the brain. Which symptom is usually last to become permanent in the progression of Meniere's disease? Vertigo, tinnitus, hearing loss, oral fullness. Answer is hearing loss. In the progression of Meniere's disease, hearing loss often become permanent in the last stage. The chronic vertigo and persistent tinnitus may be also there. Which lifestyle factor is commonly modified to reduce symptoms of Meniere's disease? Option are increased exercise, caffeine reduction, high protein diet, alcoholic intake. Answer is caffeine reduction. Caffeine reduction can help decrease the frequency of vertigo in patient of Meniere's disease. Which of the following is considered a preventive medication for Meniere's disease? Antihistaminics, antiemetic, beta-histine, proton pump inhibitors. Answer is beta-histine. Beta-histine is often used as preventive medication in Meniere's disease to reduce frequency and severity of vertigo attacks. Meniere's disease is best classified as which type of disorder? Infectious, autoimmune, degenerative, idiopathic. Answer of this question is idiopathic. Meniere's disease is considered idiopathic as its exact cause is unknown, although it involves endolymphatic hydrops and immune-related factors. Which diagnostic criteria is required for a definitive diagnosis of Meniere's disease? Options are audiometric documentation of hearing loss, continuous vertigo for 24 hours, positive family history, and complete resolution of symptoms between attacks. Answer of this question is audiometric documentation of hearing loss. A definitive diagnosis required PTA documented hearing loss. Symptomatologically, Ménière disease is two types, definitive and probable. Definitive Ménière disease required at least 2 episodes of vertigo, each lasting 20 minutes to 12 hours, audiometric confirmation of SN loss, tinnitus, and other symptoms which are not related to vestibular other diagnosis. Then it is definitive. In probable, rest symptoms are seen except there is no documentation of hearing loss like in audiometry. Which dietary factor is commonly implicated in worsening symptom of Ménière disease? High protein intake, high sodium intake, high calcium intake, high potassium intake. Answer is high sodium intake. High sodium intake can lead to increased fluid retention, which may exacerbate the symptom of Ménière disease. Which is the main symptom that differentiate Ménière disease from other causes of vertigo? Oral fullness, positional vertigo, spontaneous episodic vertigo, and constant dizziness. Answer is spontaneous episodic vertigo. Ménière disease is characterized by spontaneous episodic vertigo that lasts for 20 minutes to several hours, distinguishing it from the other type of the vertigo. What is the primary aim of using intratympanic gentamicin in Ménière disease? Improve hearing, control vertigo, reduce tinnitus, cure the disease. Answer is control vertigo. Intratympanic gentamicin is used to control vertigo by chemically ablating the vestibular function of the inner ear. Which diagnostic test is useful for evaluating hearing loss in Ménière disease? Caloric testing, electrocochleography, pure tone audiometry, and vestibular evoked myogenic potential. Answer is pure tone audiometry. Pure tone audiometry is to evaluate the hearing loss. Which key feature is low frequency hearing loss in Ménière disease? Which of the following is a commonly used imaging test to exclude other causes of vertigo in Ménière disease? X-ray, CT scan, MRI, ultrasound. Answer of this question is MRI of the brain. MRI of the brain is used to exclude other causes of vertigo such as vestibular schwannoma in patients with suspected Ménière disease. Which type of hearing pattern is typically seen on an audiogram in late stage of the Ménière disease? Reverse slope, flat sensory hearing loss, U-shaped cookie white curve, conductive hearing loss. In late stage Ménière disease, audiogram typically shows a flat sensory hearing loss across all frequencies. What is the role of vestibular rehabilitation in Ménière disease? To cure the disease, to improve balance and reduce dizziness, to improve hearing, to reduce tinnitus. Answer is to improve balance and reduce dizziness. Vestibular rehabilitation help improve balance and reduce dizziness by promoting central compensation for the loss of vestibular function. Which of the following factors may improve the prognosis of Ménière disease? Early diagnosis and treatment, high caffeine intake, lack of treatment, frequent exposure to loud noise. Answer is early diagnosis and treatment. Early diagnosis and appropriate treatment can help manage symptoms effectively and improve overall prognosis of the Ménière disease. Which class of drug is not typically used in the management of Ménière disease? Options are antiemetic, antihistaminics, antibiotics, and diuretics. Answer is antibiotics are not routinely used in Ménière disease. Which of the following is a common non-pharmacological treatment option for Ménière disease? Hearing aids, antidepressant, anti-seizure medications, and thyroid hormone. Answer is hearing aids. Hearing aids are commonly used to help manage the hearing loss associated with Ménière disease. Which of the following conditions is often associated with endolymphatic hydrops? Autoimmune disorder, acoustic neuroma, labyrinthitis, autosclerosis. Answer is autoimmune disorder. Secondary endolymphatic hydrops can be associated with autoimmune disorder leading to symptoms similar to those of Ménière disease. In the diagnostic criteria for Meniere's disease, how many episodes of vertigo are typically required? One episode lasting less than 20 minutes, two or more episodes lasting at least 20 minutes each, continuous vertigo lasting 4 days, daily episode of vertigo for 1 month. Answer is two or more episodes lasting at least 20 minutes each. The diagnostic criteria for definitive Meniere's disease require two or more spontaneous episode of vertigo, each lasting for at least 20 minutes. Which of the following finding on electrocochleography is suggestive of Meniere's disease? Reduced summating potential, elevating summating potential, action potential ratio, normal summating potential or action potential ratio, absent auditory brainstem response. Answer is elevating summatic potential, action potential ratio. An elevated summatic potential, then the action potential is the suggestive of endolymphatic hydrops, that is indicative of Meniere's disease. Which part of the inner ear is primarily affected in Meniere's disease? Cochlea, semicircular canal, vestibule. Answer of this question is all of the above, because it is a complete disease of the inner ear. What is a commonly reported trigger for vertigo attacks in Meniere's disease? Exposure to bright light, consumption of alcohol, high fluid intake, quiet environment. Answer is consumption of alcohol. Consumption of alcohol along with stress and dietary factor is commonly reported to trigger vertigo attacks in Meniere's disease. What is the effect of gentamicin injections on hearing in Meniere's disease? Options are improve hearing, no effect on hearing, may worsen hearing, restore normal hearing. Answer is may worsen hearing, because gentamicin is cochlea or vestibular toxic that can control vertigo but may worsen hearing because of ototoxicity. Which aspect of lifestyle modification is often emphasized in patients with Meniere's disease? Weight reduction, regular exercise, stress reduction, sleep deprivation. Answer is stress reduction. Which vestibular suppressant is often used for acute attacks of vertigo and Meniere's disease? Lorazepam, metoclopramide, maclizine, prochlorperazine. Answer is maclizine. Maclizine, a vestibular suppressant commonly used to treat acute episode of vertigo in Meniere's disease. Another therapy is beta-estine, also commonly used. Which of the following is not typical feature of Meniere's disease? Pulsatile tinnitus, episodic vertigo, fluctuating hearing loss, oral fullness. Answer is pulsatile tinnitus is not typically associated with Meniere's disease. In Meniere's, there is continuous fluctuating non-pulsatile tinnitus is there.